Hello, everyone. Imagine you're preparing medications for your patient. You've carefully checked the medication, verified the dose, and you're reading the medication label when another nurse walks in and asks you a question. At the same time, a phone begins ringing and an IV pump alarm sounds down the hall. What would you do? Would you immediately stop what you're doing? Would you answer the question while continuing to prepare the medication? Or would you have a strategy to safely manage the interruption? In healthcare, interruptions happen constantly. They are a normal part of nursing practice. But how we respond to those interruptions can make the difference between providing safe care and making a preventable error. Today, you're going to learn an evidence-based strategy called Stay Safe. Research has shown that nurses are interrupted frequently, especially during medication administration and patient handoff. The goal isn't to eliminate interruptions. That isn't realistic. Instead, we want to learn how to manage them safely. Think of interruptions like driving in the rain. You can't stop the rain, but you can learn how to drive safely in it. That's exactly what Stay Safe teaches you to do. Stay Safe is a simple 5-step strategy you can use whenever you're interrupted during an important nursing task. Let's go through each step together. Step 1. Stay physically where you are. When someone interrupts you, don't immediately walk away. Stay where you are. This helps keep your attention focused on the task you're completing and prevents you from losing your place. Simply stopping and remaining in place gives your brain time to process what's happening. Step 2. Stay focused on the current task. Next, keep your attention on the task you're performing. Instead of immediately shifting your focus to the interruption, continue looking at your medication, IV pump, or whatever you're working on. Avoid trying to do 2 things at once. Multitasking often feels efficient, but it actually increases the chance of making mistakes. Step 3. Associate a cue. This is one of the most important parts of the framework. Create a reminder that helps you remember exactly where you left off. This cue acts like a bookmark in your brain. When the interruption is over, you'll know exactly where to continue. For example, place your finger on the medication label. Hold the syringe in your hand. Keep your hand on the IV pump, or mentally repeat the next step. Step 4. Find a natural break. Before responding, ask yourself, can I safely finish this step first? If you're scanning a medication, finish scanning. If you're labeling a syringe, finish labeling. Completing a critical subtask reduces the chance that you'll forget something important when you return. Step 5. Evaluate the urgency. Now it's time to decide whether the interruption requires your immediate attention. Ask yourself, is this urgent? Can it wait another minute? If it's an emergency, respond immediately. If it isn't urgent, politely let the person know you'll help them as soon as you safely finish your current task. Remember, patient safety always comes first. Let's see Stay Safe in action. Imagine you're preparing insulin. You're drawing up the medication when another nurse asks, can you help me move a patient? Instead of immediately stopping, you use Stay Safe. You stay where you are. You keep your eyes on the syringe. You place your finger on the medication vial. You finish drawing up the insulin. Then you ask, is this an emergency? The nurse replies, no, we just need another set of hands. You respond, I'll be there in just a minute after I safely finish this medication. You have just protected both patients. Now let's look at a patient handoff. You're giving report. Halfway through, a physician asks for an update on another patient. Again, stay safe. Remain engaged in your report. Leave yourself a mental cue. Finish the current section of report. Determine whether it's urgent, then continue safely. During simulation, your instructors may intentionally interrupt you. Don't worry, they're not trying to trick you. They're helping you build a skill you'll use every day. Each interruption gives you another opportunity to practice Stay Safe. As you practice, remember these important points. Don't rush. Don't panic. Avoid multitasking. Think before reacting. Protect your patient first. Use your associative cue every single time. The more you practice, the more automatic these behaviors will become. Students who learned the Stay Safe framework reported feeling more confident and less anxious. In a study involving 4 nursing programs, nearly all students consistently used the strategy after learning it, applying it in clinical experiences, and even while studying. It's a skill for every clinical setting. Let's review the 5 steps one more time. Stay where you are. Stay focused on your task. Associate a cue. Find a natural stopping point. Evaluate the urgency. It only takes a few seconds, but those few seconds can prevent a serious error and improve patient safety. As you progress through nursing school, remember that interruptions are part of healthcare. The goal is to manage them safely. By practicing stay safe, you'll strengthen your clinical judgment and keep your patients safe. Thank you for watching. We look forward to seeing you apply it in practice.